I'm Karen Herbst. I'm here at the ACP meetings in 2017 in Austin, and I'm here with Tom Wright. And Tom, I just wanted to ask you how you take care of your patients with lipedema. What are you doing to improve their lipedema?
Okay, so lipedema, it really has to start with complete decongestive therapy. That means, and I can't tell you how many of the ladies have not been fully geared with compression therapy, adequately treated with that, adequately treated with manual lymph drainage and these sort of things, because even the conservative therapy is so important because it does. So many people have experienced significant improvements with the conservative therapy. That said, if once their conservative therapy is adequately implemented, then for some that wish to proceed, we do lymph-sparing liposuction to decrease the burden of lymphedema fat.
And would you say that when you do the liposuction that it actually functions as additional decongestive therapy?
Yes, it seems to not only serves to remove the bulk of the tissue, but it also relieves symptoms of lipedema. The heaviness, some of the achiness, tenderness resolves as a result of just removing the fat.
And do you think that their mobility improves after liposuction?
Very much so. So, in fact, I follow the flexibility in joints of my patients before and after liposuction, and we see significant improvements in their ability, their flexibility in their knee and ankle joints that really gives them much more mobility.
And what about diet and exercise? Do you recommend those kind of things?
Very strongly. It really, that is the cornerstone of the conservative therapy, is there really has to be really of low carb, and we recommend like a modified, the RAD diet, which is a modified Mediterranean diet to that seems to have low stimulus for inflammation.
So it sounds like the standard of therapy is complete decongestive therapy, compression garments, and then diet and exercise. And for those that are interested, liposuction to improve their mobility, to decrease their pain, and give them a better quality of life.
Yes, that's well said.
In a
Dr.
nutshell.
Herbst.
Tell me a little bit more about lymph-sparing liposuction.
Okay, so lymph-sparing liposuction really is liposuction we gear towards lipedema patients. And the principles involved is first to make sure that they are optimally decongested, and that that we are doing all the conservative things that are going to decrease the inflammation in the lymphatic system, and once we've achieved that, the goal of lymph-sparing liposuction is not truly cosmetic. In fact, the goal is actually to remove as much fat cells as possible, because we believe the fat cells are diseased, as you, Dr. Herbst, have been showing us with your research, and so cosmetically we would leave fat in for the ideal skin look, but that is not. We actually want is remove as much of the lipedema diseased fat as possible.
Yep.
The other thing is the technique, and it really is so important that it's that we use very abundant tumescent, and that helps protect the lymphatics and small venous venules and small lymph veins, as well as small cannulas, and Dr. Klein and others have shown very well that small cannulas are less traumatic, and also the technique has to. We want to avoid transversing the lymph collecting ducts, which lie deep on the just on the epifascial layers of the muscle and in the saphenous spaces. And so it's very important that a lot. This means that it takes more time, but in the end, the patients deserve that because any injury to their lymphatics could exacerbate their disease.
Mm-hmm. But we don't really see a lot of lymphedema after liposuction.
No, and if, in fact, I see an improvement in swelling after liposuction, but I have to think some of that is because we're so careful not to. I mean, I wouldn't want to test the hypothesis that if you did, because there actually is a good study that shows that drier liposuction can injure the lymphatics, and I wouldn't want to subject anybody to that.
And we've shown with some hands-on therapy techniques that improving the quality of the tissue allows the fat tissue to actually respond to environmental cues of diet and exercise. And I think the same thing happens with liposuction. You're improving the quality of the tissue, so now they're more mobile and the blood flow is better, and so the tissue starts to enter back to being normal as opposed to having that abnormal lipedema structure.